Now, I want to say a few words about the recent claims that have been made regarding WHO, the amendments to the international health regulations, and the pandemic agreement. Let me be crystal clear. First, the IHR, its amendments, and the pandemic agreement, all of them were proposed, negotiated, and adopted by our member states. That's how WHO works. It belongs to the countries, to all 194 member states. Second, WHO has no authority to tell countries what to do. We cannot impose travel bans, lockdowns, vaccine mandates, or any other type of measure, nor do we seek to. That's clearly laid out in our founding document, the WHO Constitution. Our job is to provide evidence-based recommendations and guidelines and to support countries to protect and improve the health of their populations. But how or whether countries implement that advice has always been and always will be up to them, based on their national guidelines and rules. That's true for everything we do, whether it's guidelines for stopping smoking, better nutrition, or preventing and addressing disease, everything we do. This principle applies equally to international health regulations, and in fact, the new pandemic agreement even has a specific section clearly spelling that out, Article 22. And third, we have a very clear, comprehensive framework in place to guard against undue influence of pharmaceutical manufacturers and other private sector entities. Of course, we work with them, as we should, but we have very clear safeguards in place that were developed with our member states. And now a quick update on the pandemic agreement and specifically the Intergovernmental Working Group. This working group, made up of our member states, was established by the World Health Assembly and tasked with negotiating the Annex for Pathogen Access and Benefits Sharing, among other things, to help the world respond more effectively to future health threats. The working group will meet throughout the year, with the aim of bringing the completed annex to the next World Health Assembly in May 2026. The pandemic agreement, negotiated over 3 years by our member states, builds on the lessons of COVID-19 to improve cooperation and coordination for a safer world for all. Now, moving from future threats to current ones. WHO and UNICEF's recent annual report on estimates of national immunization coverage around the world show both progress and pressing challenges. While there has been modest growth in vaccine coverage globally, an estimated 14.3 million children never received a single dose of any vaccine, and millions more received only partial coverage. Not surprisingly, children living in one of the more than 24 countries affected by conflict or humanitarian emergencies are at particularly high risk of missing out on life-saving immunizations. For measles, one of the world's most infectious pathogens, while global coverage is up slightly from last year, nonetheless, more than 30 million children did not receive the full course of vaccines they needed. In 2024, 60 countries experienced significant measles outbreaks, nearly double the number in 2022. While lack of access is one major problem for vaccines, vaccine hesitancy is also a widespread concern for some. WHO and other public health organizations have detailed information available on our website to help families understand vaccines which have saved millions of lives since the development of the smallpox vaccine over 200 years ago. On that note, I'm happy to share some news about another revolutionary innovation. Last week, WHO launched a new guideline on the use of lenacapavir, a breakthrough prevention medicine that can help turn the tide on HIV. HIV protection from injectable lenacapavir lasts for 6 months and prevents more than 96% of new infections. WHO and partners are working with 9 early adopter countries so that up to 2 million people will be able to access lenacapavir at a negotiated lower price. 6 generic manufacturers are in the process of developing lenacapavir, and by 2027, generic versions will become more widely available. WHO is working with the early adopter countries and global partners to make the use of lenacapavir a reality, including through guidelines and the pre-qualification process. And some more good news on global efforts at disease elimination. WHO is proud to have certified Suriname as malaria-free. That makes 47 countries and territories to have received certification, with more on the way. We have also recently validated the elimination of trachoma as a public health problem in both Burundi and Senegal, bringing the total number of countries that have eliminated at least one neglected tropical disease to 57. Tariq, back to you.
Thank you so much, Tariq. I just wanted to go back on the IHR regulations that Dr. Tedros spoke at the top about. And I was wondering if there's been any more outreach or communication with the U.S. administration about that particular issue, besides them saying they're not going to adopt the changes to the regulation, and cooperation with the WHO in general, at the higher level, not the technical level. Thank you.
Thank you, Carmen. Maybe Mrs. Steve Solomon can take this one.
Thank you for the question. Maybe I can provide some context to help with answering that question. So in May 2024, the World Health Assembly, the WHO, adopted amendments to the International Health Regulations, the IHRs. These amendments will strengthen cooperation among countries when global health emergencies arise. That adoption by the World Health Assembly opened the door for a period of consideration by each country domestically. It's a step-by-step process. Countries consider it together at the World Health Assembly and then individually as a national matter, and this ensures fidelity to the principle of national sovereignty. The deadline for countries rejecting these amendments, which were adopted at the Health Assembly last year, the deadline was July 19th. That's last Saturday. That deadline has now passed, and it's now clear that the 2024 IHR amendments will apply to the overwhelming majority of the 196 countries that are party to the IHRs. All the specifics will be released soon, but at this time we can say that in addition to the US, and this is the question you raised, in addition to the US, which made public its rejection of the IHR amendments, less than a handful of others have substantively rejected them. So again, the 2024 amendments will apply to the overwhelming majority of all countries in the world. In sum, the status of the IHRs as a nearly universal instrument to help countries prevent the international spread of disease remains strong. Thank you.